गुड आफ्टरनून सर.
Good afternoon. Yeah.
सर फर्स्ट ईयर में हम anatomy को like we everybody has grudges with anatomy. No one knows how to study it. So sir, you being the favorite teacher of all, evergreen favorite teacher, sir थोड़ी सी tips anatomy के लिए.
No, anatomy is actually interesting subject, and it is very basic and foundation for all the medical subjects. So everyone should know anatomy. Not even medical students. Even laymen also should know the structure of our own bodies. So if you study in that way, anatomy is really interesting. So as per my experience, anatomy is not only reading, it is like visual memory. You should see the structures in the cadavers, go back and see the any atlas, all these things, sources you can use, and you should see the structures, visualize the structure, and keep it in your memory. That is the best way to study. Of course, names you should know. So especially limbs you can visualize in your own body, where that particular muscle comes, where that now runs. That is the best way to learn anatomy.
And sir, like it is very volatile subject also. So like how to manage?
Yeah. So my advice is getting the concept is that way only. You should visualize the structure, imagine in your own body, all these things. But immediately you should prepare exam-oriented study also. You should do that. So each and every topic or chapter, immediately you should know that what questions will come from in this chapter, and immediately you should prepare the answer for that. Answer is just headings and points. So that will help you a lot to face the exam, and of course your knowledge also will improve in that only. So that is the best way.
And sir, like how to make notes from the books and PPTs, question bank.
Yeah, that's what. Question and answer is only best way. Question and answer only. You get the question and prepare answers. Like, see, in textbook they'll write para. So you should convert it into headings and points. Now, for example, if you are studying a boundary of one region, medial, what is the boundary? Lateral, what is the boundary? So for each question, you derive the objectives, or each topic derive the objective. What is the objectives for this topic, and make points.
And sir, what about embryology?
Yeah, embryology also is actually interesting because you are studying our development, and you can correlate the function of that organ after fully developed organ. You can correlate with its gross structure as well as function. So that is also interesting. So in textbook, most of the textbook they give week wise. You need not go according to that. You can take small parts, and you can make the notes, points. What are the events? You can make like flow chart. That is also best way. Flow charts you can do. What are the events taking? Whatever structure you take, what you are going to learn in that is how it is formed. What is the steps in formation of that? What is the fate of that structure, that embryological structure? That's what you are learning in embryology. So every structure or any point, how you have to study is what is the structure, what is the process in the formation, you can write points, and what is the fate of that structure, and anomalies. If something goes wrong in this process, what happens? So that is embryology. So you can practice line diagrams and flow charts.
And sir, what about histology?
Histology also like that only. It will help you to understand the function of or gross structure of that organ. So histology, what you can do is when you draw, especially you have drawing part also. So you should know what part you are seeing under the microscope. Now, for example, if you are seeing a liver slide, which part of the liver is taken, how this slide is taken, that is very important, because most of the student, they won't understand only which part of the organ is taken. For example, simple intestine is there. So how the section is taken, what part you are seeing under microscope, that is first point that you should know. Because most of the students, histology is just pink and blue color. It's not like that. You are seeing some structure in that, but it is stained, that's it. So if you understand that gross structure and see the microscopic structure, it will be very helpful. Then when you draw also, you understand what you are drawing. It's not just lines, what part you are drawing. For example, this is capsule invaginates inside to form septa, and this is parenchyma. Inside the parenchyma you have follicles or acini. Like that you should draw. Then only it will be helpful. Some organs you can compare and study. That is also best way to study histology. For example, if you are taking cartilage you have three slides.
Yes,
elastic cartilage, hyaline cartilage, and white fibrocartilage. So you can club them together and compare and contrast. because there will be a common structure for those cartilages. But hyaline cartilage has got its own feature. Elastic cartilage has got its own feature. So you should compare and contrast. That also will help you to remember the things and understand the things. Even
Yeah.
blood vessels also. Blood vessels has got some common structure. Plus you have different types of blood vessels. Artery, elastic artery, muscular artery. Again you can compare and study. Entire GAT is actually one structure, but it has got some differences. So that is the best way. You should compare and study.
Histology, it's very difficult for the students to grasp all the diagrams. which
Yeah,
we
that's
made.
what. That's what. Actually, see, large intestine is different, small intestine is different. Actually, you will be studying like that. No. See, all the GAT tract has got 4 common layers. So, what is the difference between these two? If you understand that, it will be very easy to recollect and draw.
And so, like for the answer framing of the anatomy in
Yeah.
the question paper, like any advice would you like?
Yes, yes. See, any area or any structure you take, as I told, you should derive the objective of that point or question. For example, if you take a noun, so what you should study in the noun, you should know the origin of that noun, course of that noun, then branches and distribution. So make these headings and put point in front of that. Then applied aspects. So in that also, if you take nouns, you can compare all the long nouns together. Then you study. Comparing and contrasting is best way to study.
Like रिवाइज कैसे करें सारी चीजें बार बार
Yeah,
ताकि याद रहे.
yeah, yeah. Now, if you make notes, see, if you prepare the answers in that organized manner, like headings and points, your time consuming for the preparation also will decrease. Recollecting will become easier. To write it in exam also, it will be very easy. You need not to think or frame the answer in examination hall, because it is already framed. You just go and put that answer in the answer script. So that is the best way. So prepare notes, make headings and points, keep on revising it. So if you revise the headings itself, points automatically will come in front of that. For example, if you know the objective of that part, for example, cuboidal fossa. In cuboidal fossa, what you have to write? Medial wall, lateral wall, contents. So automatically, when you write the headings, automatically things will come after reading 2 to 3 times.
And sir, like, do you prefer YouTube videos for studying?
Definitely, it will improve your concepts, visualization, all whatever recent advanced medias are there or sources are there. They are really helpful.
Sir, what do you think about the significance of dissection hall?
As I told, visualization. See, anatomy is not just remembering the things or remembering the words. You should see the structure. Then only it will help you. Anatomy is nothing but seeing the structures and remembering the relations, course, all these things. So without seeing it, you can't remember. So you should see it, feel it. Then only it will be helpful. So attending dissection class is very, very important. Without seeing the structures, keep it in your brain and remembering everything is very difficult. Yeah, neuroanatomy is also, yeah, of course, it is a very difficult part in anatomy. So neuroanatomy also, one thing is, yeah, you should come to DH and see the structures, visualize the structures, understand, and go back and make your own concept maps, like line diagrams, points, charts, flow charts. That will help you. And then connections and all, in anatomy we won't give much importance. Connections also like that only. You understand, read entire thing, understand the topic and make it very simplified points and put it in chart. That is the best way. And watch some videos also, because that 3D dimensional picture for neuroanatomy is very, very essential. For example, now if you take a brain, if you prick in the parietal lobe, what and all structures will be pierced by it. That imagination you should have. Otherwise, you won't get the orientation of the structure only. That is very, very important. That also you can do. Then books. Now in our college, Vishram Singh is the reference book. Vishram Singh has got a separate book for neuroanatomy. That is clinical neuroanatomy. That is really good. Even points are nice. Diagrams are very clear. Even applied aspect also has given very well. So that you can refer. Embryology also, Vishram Singh has got one separate clinical embryology book. That is very good. Even points and diagrams are very nice, including applied aspects. Histology we refer Indrabir Singh. Indrabir Singh is fine. And apart from that, I prefer, now electronic gadgets are there with everyone. You take the picture, even microscopic picture also, plus diagram also, handwritten diagram also, and make your own point. How will you write for short notes? Plus, what are the identification points? That will help you in histology also. Later, it will help in pathology also. That is very, very important.
According to you, what is the significance of anatomy in NEET?
NEET, yeah, NEET exam also, they'll ask anatomy question. Now, last NEET exam, there was like diagram based questions. They had put some diagrams and labeling and all was asked. Plus, there will be like applied questions also. For example, nerve. So, knowledge of anatomy is very, very essential because all other subjects are based on anatomy knowledge only. So, you should have the strong foundation of anatomy for to understand other subjects, including surgery, medicine, anything.